Welcome to the Inova Peterson Life with Cancer Women's Sexual Health Series. My name is Lauren Broshak. I'm one of the oncology social workers and therapists here at Life with Cancer, specializing in sexual health. And I am so excited to be here with you for the fourth session of our Women's Sexual Health Series. I'm going to go ahead and ask my colleague, Rebecca, to pop on camera here and introduce yourself as well before we get started.
Hi, everybody. I'm Rebecca DePace. I'm Lauren's colleague here at Life with Cancer. An oncology nurse navigator specializing not only in cancer, but in sexual health. So I'm really happy to be here tonight. And Lauren and I really appreciate you coming and attending our sessions. We know how valuable they are. So excited for tonight and the continuation of the series. Thanks a lot.
Before we get started into our presentation, we do want to share a little bit of information about not only this program, but our Life with Cancer program as well. We first have to say a big thank you to the Cancer Action Coalition of Virginia, and the CDC for the grant that was awarded to us to be able to support and put on this program. As you can see, we have many talks from January through June. We're on number 4 here tonight with Dr. Lori Brotto. And you'll see there's a few other topics with invigorating eroticism, an overview of women's sexual health, managing distress, finding pleasure, treating sexual concerns, psychosocial adjustment for couples, and sexual desire in the coming week. Life with Cancer is a part of the Inova Cancer program. It provides education and psychosocial support to all individuals impacted by cancer. So that's both those who are diagnosed and their loved ones from that time of diagnosis to survivorship and beyond. Our mission is to enhance the quality of life of those impacted by cancer by providing evidence-based education, support through support groups and individual consultations with therapists, navigators, and dietitians. We also offer wellness programs, integrative therapies, all at no cost. We also offer additional sexual health programming, such as the Women's Sexual Health Support Group, Get Your Groove Back, or our pelvic floor health movement classes. Inova Cancer also has the specialty shop for those that are local to the Northern Virginia area with products to support cancer treatment and survivorship experience. In addition to what you see here, we also have dilators, lubricants, and moisturizers at the shop that not only can be bought at the shop, but even bought or sent to your home if you're local and want to check it out. We have a few logistics for you. All questions will be answered at the end of the presentation. We ask that you submit questions in the Q&A feature and use the chat feature to connect with one another, to say thanks, or be able to support one another in validating experiences that maybe you're having that you saw somebody else share in the chat, and use the Q&A just for the questions. We also ask that if you're able to rename yourself to whomever is with you. So if it's you and somebody else with you, including both people in your name, with first name and last initial if possible, which allows us to then be able to track who's registered and attended tonight. Lastly, the information contained in this presentation is for information and educational purposes only and should not be treated as medical advice. So we want to make sure that you're aware of that and encourage you to not only ask questions here, but if you do have personal questions for your own treatment plans, to also include your providers in that after today's session. I am so excited to introduce our speaker tonight. Dr. Lori Brotto is here with us. She's an internationally recognized leader in sexual health research. She's the executive director for the Women's Health Research Institute in British Columbia, Canada. She's mentored 150 trainees and evaluated mindfulness and psychological interventions for sexual dysfunction and genital pain, which collectively impact 1/3 of women. And she has a particular interest in sexual health among cancer survivors. Her work influences practice internationally, with mindfulness now implemented in sexual medicine centers and recommended as frontline care in international guidelines. In recognition of her contributions, she holds a Canada Research Chair in Women's Sexual Health, has received recent awards in mentoring junior faculty, excellent public education through media, book awards, and is listed among the top 2% cited scientists by Stanford, Elsevier, and Scopus citations. We are so excited and thrilled to have you here with us, Dr. Brotto. Thank you so much for being here.
Thank you so much, Lauren and Rebecca. I too am very, very excited to be here. And let me just double check, Lauren, that my slides look okay.
They look great.
Excellent. Okay. Welcome, everyone. I was kind of Googling oogling the list of different speakers you have in the rest of the series, and several of my friends are presenting, Sharon Bover and Rachel Rubin and a few others, and this looks like an absolutely amazing series. So thank you for taking the time to be here. Thank you for prioritizing your health and your well-being. And thank you for being present with a topic that for a lot of people, for a lot of us, is actually really difficult to talk about. And so my goal for today is to ease some of the embarrassment or the shame around it, and hopefully give you a tool that you can use in your own lives. So just to get started, I do have a disclosure to make, and my disclosure is I'm a proponent of paying attention, and I have written 2 books on the topic, as Lauren mentioned, and we'll be talking a little bit about the books, but mostly about the skills. And again, my goal is that you walk away with some very tangible skills that you can implement in your own life. So we know that sexual concerns following a cancer diagnosis, cancer treatment, and even many years into remission is associated with high levels of sexual difficulties. This is one of the more recent large-scale studies that was done. This was done on males and females at a center in Germany with 4,000 people who were just over 1 year out of their diagnosis of cancer. And what this study found was that 32%, so about 1/3, were reporting distressing sexual problems after cancer. So what do we mean by that? Well, a sexual concern might be sex hurts. It might be I'm no longer interested in sexual activity. It might be sex doesn't feel pleasurable like it used to. It might also be I get riddled with anxiety or fear or worry when I engage in sexual activity, and that those difficulties elicit significant distress or upset. So it's a symptom that you worry about, you think about, and often, unfortunately, in a lot of silence. What we do know among females is that the rates of sexual difficulties are much higher in breast cancer survivors and in gynecologic cancer survivors. This doesn't mean that the other cancer types that females can experience don't have sexual difficulties, but for a variety of reasons, not the least of which is also that breast and gynecologic cancer survivorship tends to be studied a bit more when it comes to sexual health. So there's a real need to study more the impacts of lung cancer, of hematologic cancer, of colorectal cancers on sexual complaints, because we do know that they can also be extremely common. So why is this something that we care about? We know definitively, and I know I have a citation of a scientific study on the page, but I think any of you, any of us can relate to this, that when sexual health is not how it was before, or if it's experienced as problematic and upsetting, it doesn't live in a vacuum. It can impact many different facets of a person's life. It can be a direct insult to your sense of self, especially if you're someone who valued that part of yourself as being a sexual being, a sexual partner. We also know that it can impact mood and anxiety, especially if a person doesn't receive effective treatments for it. They might start to have beliefs such as, I'm broken, will I ever resume my sexual health? It can also create poor psychological adjustment in general, so impacts to quality of life, and can impact willingness to use different medications, especially if there's a fear of those medications having additional sexual side effects. So I know whenever I'm asked, whether it's by someone on the cancer care provider team or someone, why do you spend so much time focusing on sexual health and survivorship? Aren't we most concerned about the person fighting their cancer, overcoming their cancer, beating this cancer? And my answer is yes, absolutely. That is first and foremost. Yet, when there are impacts on sexual health, it can take quite a lasting toll for many, many years. So I think it's really important that in the context of receiving a diagnosis, and certainly throughout care, that we focus some time and effort on talking about sexual health. And again, that's why I'm so thrilled about this series and so excited for all of you to get the education that you're getting. So it's really important, but as care providers, we're not doing so great. When we look, this is mostly among gynecologic oncology care provider teams, so the oncologists, gynecologic oncology nurses, et cetera. Less than a quarter have said that they've actually received training in their education on how to address sexual health with cancer. Yet, on the other hand, almost all of them were asked by a patient at some point about sex. What's the impact of this particular chemotherapy on my desire? How will removing my ovaries impact my ability to orgasm? So most of them do get asked, yet only a fraction receive training in the area. Pretty good is a figure that over half try their best to provide information to all of those who ask about sex. But here we see some differences. The more years out from their training, in other words, you could say the older the provider, the less likely they were to talk about sex, and the more likely they were to adopt the belief sex is private and discussing it will interfere with our care. And on the other hand, younger doctors were twice as likely to support patients choosing treatment based on sexual side effects. And we actually are starting to see some of these trials. I was a co-author on a large study comparing two different kinds of hysterectomy. It was just published this year. And one of the things that we measured, in addition to morbidity and mortality, was impacts on sex. And what we found was that the less radical surgery was just as effective as the more radical surgery for improving life and health outcomes, but had far fewer sexual side effects. So armed with this information, we can present this to patients to say, look, you have a choice in the matter. Now, there's a lot more research we need to do, but this research is starting to emerge, which I think is amazing. So going back, why is this such an important part of our discussions and our holistic care for survivors? And I talked about some of the impacts when there is sexual difficulty. Coming back to this particular study, what they found when they followed survivors over time is that those individuals who had sexual problems tended to report higher levels of depression, anxiety, and distress, lower overall quality of life. They also reported having less social support in their relationships, and they were living with a partner. Now, that doesn't mean that living with a partner causes sexual problems. In fact, what it probably means is that if you were living with a partner, you are more likely to be aware of your sexual difficulties because you were presumably in a partnered sexual relationship. And the reason I show this slide is because in this very large study that was done in Germany, what they found was that it very much went in this direction. It was that the sexual difficulties led to these other things, the higher rates of depression, lower quality of life, as opposed to the other way around. So again, it really behooves us to pay attention to this aspect of health. It is an aspect of quality of life. The WHO has declared it many, many years ago as a fundamental part of health and well-being. And so we should be paying attention to it, particularly in the context of cancer care. Now, before I start moving on to treatments, what's really important to point out, because certainly as a psychologist, I often get asked, well, isn't it mostly due to surgery? Or aren't the effects mostly due to the hormonal changes that happen with my cancer treatment, the ovaries being removed, chemotherapy forcing a person into premature menopause, surgery damaging certain nerves that are really important for sensation and pleasure, etc. And while all of that is true, what we also know actually is that some of the psychological aspects of a cancer diagnosis and cancer survivorship can also directly impact a person's sexual health. So as one example, body image, and I loved that Lauren showed some of the things in the store, some of the undergarments, some of the things that are really designed to help a person feel, themselves, designed to help a person feel whether it's feminine or sexy or whatever label resonates with you. I think that's so important because there are real body image changes. And with certain types of cancer, let's say if there's extenuation of the vulva in the case of a vulvar cancer, or a mastectomy or a lumpectomy in the case of a breast cancer, certainly there can be real changes to body image, not for all, but for a significant number of people that directly affect how they show up sexually, how comfortable they feel, let's say with the lights on, how they feel about having a partner touch them or not touch them. And so these psychological factors are really, really important. And it also means that when we discuss treatments for sexual issues that happen in the context of cancer, we have to pay attention to a person's psychology. The other big bucket, of course, is the sociocultural / interpersonal, basically everything else that falls outside of biology and psychology. What does a person's culture say about a cancer diagnosis? Certainly, where I live in Vancouver, I work with a very high volume of people of South Asian descent or East Asian descent, where there's a lot of shame around certain types of cancer diagnosis that lead women to really suffer in silence. And so if layered on top of that, sex hurts, or there's a loss of desire, it can reinforce some of the cultural shame around, why did I get cancer? What did I do in my life in order to get this diagnosis? So this is also really important. And I think really important for any of you who are attending today, if you decide that you want to take this time to really explore your sexual health, asking yourself these questions like, what are the societal messages about sex? Certainly societal messages about aging come up. And I know you had a talk on menopause already. That's also a place where this comes up. This old stereotype that old women don't have sex. And by extension, old cancer survivors don't have sex. And of course, nothing could be further from the truth. But it's really important that we confront these beliefs in order to really address sexual health. So let's move on from here. And I'm going to share with you next one of the most common questions that I get asked as a sex therapist who does a lot of work with survivors. And the question is actually, is there a little pink pill I can take for that? And reading through the list of future speakers, I'm pretty certain that Rachel Rubin will talk about that as a urologist. It's worth me mentioning that in North America, well, in Canada and the United States, there are 2 Food and Drug Administration approved medications for the treatment of low desire in pre-menopausal women. One of them is an oral medication, that's flibanserin, and the other one is an injectable medication called bremelanotide. Now, you might ask, do they work in cancer survivors? And to date, in fact, I just did this updated scientific search yesterday, and there has yet to be a published study, a well done, what we call a randomized clinical trial evaluating these medications in female cancer survivors who have sexual difficulties. There is one presentation that is published from a conference, but it has yet to undergo the rigors of peer review. So this was a study of mostly ER-positive breast cancer survivors with sexual difficulties who used the first medication, the oral one, and they used it for between 24 and 36 weeks. And while they saw an improvement in things like desire and arousal and a decrease in pain, the moment they stopped, those symptoms came back. So there's a real need to, for those researchers who are studying pharmaceutical or drug-related treatments, to actually look at what kinds of treatments have sustained effects that don't require a person to stay on a medication for months and months and months or years. So instead, what I want to talk to you about is a mindful approach. And Lauren asked me at the beginning how I became interested in mindfulness. And I was introduced to it when I was a resident at the University of Washington. I was there from 2002 to 2005. And I was introduced to mindfulness as a treatment for individuals who were really struggling in managing their emotions. So they would go up and down, within an hour of extremes of anxiety and anger and hopelessness and depression. And they would sort of ride this roller coaster of the emotions going up and down and up and down. And there have been many different treatments that have been tried for this really difficult and distressing condition that's very common. And it turns out that one of the most effective treatments is a treatment called dialectical behavior therapy that had as a major component to it mindfulness. And I remember I was learning about this and I said to myself, oh my goodness, so you mean tuning in to difficulties, tuning in to really unpleasant sensations, tuning into extremes of heartbreak and anxiety and depression and hopelessness is more effective than tuning out? And the answer was yes, it was. And had been a lot of emerging research at that time. Now, at the same time, so I was studying this as a clinician, and in my research spare time, I was working at Seattle Cancer Care Alliance in Seattle, and was doing research trying to understand how radical hysterectomy impacted sexual arousal. And so I was interviewing lots of gynecologic cancer survivors. I was measuring their sexual response. You could ask me about how I did that later. But what struck me was when the survivors said to me that I have such a profound disconnect from my body. I don't know who I am anymore. When I touch the parts of my body that used to at one time give me pleasure and a sense of being alive, now it feels as though I'm touching my elbow. And I just had a moment of, could this method of tuning in, which is working so well for this other group of individuals, could it be useful for cancer survivors? And so I immersed myself in a mindfulness practice. I got a teacher. I started going to groups. I started reading books on mindfulness. And I worked with a group of patients at Seattle Cancer Care Alliance and said, would you be willing to learn this with me? And we'll sort of learn this and share our experiences. And thankfully, I had a small group willing to do just that. And fast forward 23 years, and it's now become a mainstay in our approach in managing sexual difficulties after cancer. So what is mindfulness? And I think one of the ways of really experiencing what mindfulness is actually to do a practice together. And so I'm going to invite you now, just wherever you are, to close your eyes. And I'm going to bet that some of you have done something like this before. Lots of cancer centers around the world deliver mindfulness-based interventions. But I'd invite you to approach this as if you're approaching this for the first time, because of course you haven't done it in this environment, online, with someone brand new. So I'm going to invite you now to just close your eyes if you feel comfortable, and just take note of your feelings, of how you're sitting in the chair, or if you're lying down, or if you're standing. Just become aware, really aware of what's going on around you right now. Just take note. Is there anything coming up in your mind? What thoughts are there? And as best as you can, just note the thoughts as mental events. Oh, yeah, my brain produces these things. I don't have to run with it. And in particular, you can even note if there's any feelings in the body, including discomfort or unpleasant feelings. And rather than trying to push them away or shut them out, just acknowledge them. Perhaps saying, here you are. That's how it is right now. Whatever sensations, whatever tension, whatever tightness, whatever pleasant feelings, just acknowledge it and say, oh, hello, I see you. And so now that we've gotten a sense of what's going on right now, we've stepped out of autopilot. The second step is to collect our awareness by focusing on a single object, the movements of the breath. And so now is when we really gather ourselves, focusing attention on the movements of the abdomen, the rise and fall of the breath, and spending a few moments just focusing on the movements of the abdominal wall, moment by moment, breath by breath, as best as you can. You don't need to breathe deeper or differently, just bringing an awareness to those sensations of breathing. Just binding your awareness to the patterns of movement in the belly, in the chest, and at the nostril. And now, as a third step, having gathered ourselves to some extent, we allow our awareness to expand. So as well as being aware of the breath sensations, you can also include a sense of the many individual sensations in the body as a whole. And we call this more spacious awareness, a sense of sensations in the body as a whole, including the uncomfortable ones, the tightness, the discomfort. And just noticing all the sensations as they arise, linger, and fade away. And then when you're ready, opening your eyes. So this was a brief 3-minute breathing space. And I love introducing mindfulness through a practice because mindfulness is very much an embodied event. This is a picture of my dog. You may have heard her in the background. Her name is Juno. And I love this analogy of the mind being like a curious puppy. And I'm sure there's some dog owners and dog lovers among you. And one of the things that is so striking when you have a brand new puppy is you watch this puppy, especially if you have a retriever or any kind of rambunctious dog, is their attention gets pulled into so many different directions. They're interested in a sound, then a smell pulls them, and oh, they see a bug on the window, and oh, they hear the doorbell, and the puppies are just pulled in all these different directions. And what do we do with a new young puppy? So we gently tug on the leash. Come back here. Come back to me. Sit, be kind, sit still. And we always embody this really profound kindness to puppies when they do what puppies do, which is they take off. And yet in some ways our mind is very much the same. Our minds are curious, they're distractible, they get pulled away, they get bombarded with thoughts, they go down the rabbit hole of one thought leading to another, leading to another, leading to another. And yet what we so often do with ourselves when our minds do that is we're hard on ourselves. Oh, I can't pay attention. I have brain fog. I hate yoga. This mindfulness business is not for me. And we tend to get really hard on ourselves. We convince ourselves that our mind is not capable of sitting still like that puppy is. And so mindfulness as an antidote to that, which is really about two things. It's about present-centered awareness, just like we practice together, where we're focusing on sensations as they emerge. But also really importantly, it's how we do that. And we do that non-judgmentally so that when our mind takes off, and so if you in this brief practice we did together had moments where your mind was being pulled apart and thinking about other things or wondering, oh, when are we going to get to the good stuff, Dr. Brotto? Great. This is what our minds do. And mindfulness is a tool for acknowledging when our minds do that, becoming aware, and then bringing it back. And if we have to do that repeatedly over and over and over again, even over the course of a minute, this is a reminder that this is a moment to practice mindfulness. So this is really what mindfulness is. Now, mindfulness has really hit mainstream, right? You'd be hard pressed to open a podcast without hearing something focused on mindfulness. Many of the major media outlets cover mindfulness. We even know that some of the technology sectors like Google and Apple, they really encourage their own staff. And in fact, they have a room at Google, which is the meditation room, because of the evidence that practicing mindfulness is actually really good for our brains, and helps us to sprout areas of the brain that we actually didn't know were capable of continuing to grow. It's this phenomenon called neuroplasticity. Neuroscientists used to believe years ago that the brain was incapable of changing after the age of 2, right? So you had to learn that language before the age of 2, or else you couldn't learn it. And then as science emerged and continued, we changed that number to age 18. And we said, as long as you learn something by the time you're 18, your brain is capable of growing and sprouting. And after that, it's incapable. We now know that there is absolutely no outer limit to our brains continuing to be plastic. And we can look at examples even, say, among spinal cord injured people, where they may lose entire sensation from the waist down or even from the neck down. And yet they can train their face and their mind and their brain to feel sensations from the neck up. And those parts of the brain that tap into those areas of the neck and the face and the head start to grow and sprout. And you can see this on neuroimaging. It's absolutely fascinating. So when I run mindfulness groups, I always start with a raisin. And I love the raisin because it's a reminder that many of us, myself included, we eat mindlessly, right? We eat without thinking about our food. We lose track of how much we've eaten. We might sit down to a delicious gourmet meal and eat so quickly that we don't savor the taste. So this is an invitation to you all, maybe in your next meal. And since for a lot of you, it is the evening, maybe you'll be leaving this talk and going to have your meal. Spend the first 2 minutes of it just eating slowly and put your fork down between your bites and really paying attention to the textures. And as Deepak Chopra said, as you turn unconscious eating into awareness eating, the next stage, awareness living, isn't far behind. So my team at the University of British Columbia in Vancouver, Canada, we've been fascinated by the application of mindfulness to different populations of mostly women, although we've done some studies with men, prostate cancer survivors, men with erectile dysfunction, and delivering different versions of mindfulness. We've done this face-to-face, online, individually, with couples in group format. And the science is pretty clear that mindfulness is a very powerful tool for improving sexual health. And I'm going to share with you one of the studies because it's one of the, well, so as far as we know, it's the largest study that was well controlled with a comparison group that evaluated mindfulness for sexual difficulties in women. And so we know that low desire is really common. As Lauren said in the beginning, it can affect about 1/3 of women. And among cancer survivors, it's much, much higher. So it's that sense of I'm not interested in sex anymore. I never think about sex. I decline my partner's invitations. I don't initiate anymore. I don't undress in front of my partner. And there's lots of reasons for the low desire. And I'm not going to get into the reasons because, again, I think you're going to get an entire webinar focused on the causes of low desire secondary to cancer. But instead, what I want to do is I want to share with you what we did in our study. So we essentially compared 8 weeks of mindfulness, and this was done face-to-face, but I'll talk in a little bit about how we've adapted this now to online formats. And women came every week for 2 hours to the group. And myself and a co-facilitator, we led them through mindfulness practices, and then gave them homework to practice mindfulness every day. And on average, they practiced about 10 minutes or so, well, 10 to 20 minutes, let's say, in the first 8 weeks, and then it sort of tapered off after that. And the comparison group was just sex education. There was no skills training, there was no mindfulness. It was just sharing some myth busting and sharing some education about sexual health to the women. So we had 150 women with low desire, and then we followed them for a year. Now, what does this actually look like when you're delivering mindfulness to women with sexual concerns? Well, the first month or so, we start out practicing mindfulness as if you were doing a regular mindfulness program. So whether you're doing a mindfulness-based stress reduction or a mindfulness-based cognitive therapy, there's lots of great apps that are out there that deliver mindfulness. And it was really important that women kind of adopt a regular practice of mindfulness before they started to adapt mindfulness into their sexual lives. So when we did adapt it, we did things like this exercise, sexual sensations awareness, where we invited women to first engage with an arousing tool, a tool being either a vibrator or maybe a sexual fantasy or reading some erotica. So something that reliably elicited some sexual arousal for them for just a few minutes. And then they listened to the sexual sensations awareness practice, which essentially was a guided body scan, but it really invited them to pay attention to arousal in their body. And so that's just one example of some of the exercises and how we kind of adapted mindfulness into these sexual scenarios. And as the weeks went on, we talked about how to incorporate their newfound mindfulness skills into partnered sexual activity, into self-touch, into looking at their body using a handheld mirror. And so the focus for the last month was very much on this kind of adapted mindfulness practice. So what did we find? Well, first of all, we found in the mindfulness group that women really wanted to attend. So we usually say 6 or more sessions counts as a full dose, and you can see the vast majority attended, almost all of it. And there was a high degree of completing the homework. And so we asked them every week to keep track. And someone who wasn't running the group asked them these questions about homework completion. So what did we find? And just to orient you, I'm not going to spend a lot of time on graphs and figures, but I'm just going to show you a few of them because I think the data are pretty compelling. So everything on the right is the mindfulness group and everything on the left is the sex education group. And then each of the colored bars represent a slice of time from pre-mindfulness to right after mindfulness to 6 months later to 12 months later. And what we found was sexual distress, which is that degree of interference in a woman's life when she has sexual difficulties, dramatically decreased and in fact continued to decrease. Now, it also went down in the sex education group, but it went down significantly more with mindfulness. And this, I think, is really compelling because the mindfulness treatment ended at the end of this orange bar, yet you can see they continued to benefit from it. And we saw something very parallel when it came to their improvements in desire as well. Importantly, we had lots of different things we were measuring, but one of the things that was important for us to pay attention to is how much they worried about sex or what we call rumination. And you can see a significant drop in rumination that continued a year later. Now, when we looked at the question of how exactly does doing these breathing exercises improve sexual desire, reduce sexual distress, and so we've got some pretty sophisticated statistical ways of doing that. And what we learned was that women's improved compassion towards themselves, the decrease in them criticizing themselves, the decrease in depression, their improvements in interoception, which is their ability to sense what's happening in the body. Again, coming back to the story I shared of the survivors in 2002 who said, I don't feel anything in my body anymore. And so what we found was that women's increased ability to sense what was happening in their body translated into improvements in desire and distress. And so we concluded from this was that mindfulness worked, and it worked for everyone in the group. Now, we then went on and in a totally separate study, we looked at what about mindfulness for genital pain? And in the context of cancer treatment, genital pain can also be really common. So whether the ovaries are removed, eliciting vaginal dryness and pain, or if there's been radiation therapy, or let's say a radical hysterectomy, or many other treatments, in fact. We know graft versus host disease for hematologic cancer survivors. All of these can lead to pain with vaginal insertion or pain with sex. And there had been a growing literature showing that mindfulness is effective for pain relief, not for sexual pain, but for general pain. And it reduces muscle tension. It addresses people who are in pain, their tendency to be in the future and worry about it. It can go directly to the pain center and change the pain center to experience pain less. And so what we did was we did a randomized trial where we compared mindfulness versus cognitive behavioral therapy, which is another evidence-based treatment for PVD, basically is another way of saying sexual pain. And so what we did is we recruited about 130 women who had this diagnosis of provoked vestibulodynia, and then they were randomized. And the mindfulness treatment was very similar. So 8 weeks, every week they came to group, we practiced mindfulness together, and then they went home and practiced in between sessions. And I'm going to show you just one graph. And the one graph I'm going to show you is women's self-report of pain. And what we found here, and this was actually a really surprising finding, look at the mindfulness group, a dramatic drop. So at baseline, their pain ratings were 6.7 out of 10, and it went down to 4 at the end of treatment, and it went down even further a year later. And so we've been really happy because mindfulness has now become a frontline recommendation for many of the treatment centers that manage women with vulvar pain, which I think is amazing. Now, the last study I'm going to go over very briefly is where we bridged these 2 different mindfulness treatments, the one for low desire, the one for genital pain. And given that we know breast cancer survivors, but really many different kinds of cancer survivors, experience both. They're no longer interested in sex. They have pain with sex. Their capacity for orgasm is compromised. We asked the question, what happens if we deliver mindfulness to this group? So this was published just last year. And we had breast cancer survivors, and you can see some of their statistics. On average, they were about 50 years old, mostly in a relationship, and you can see the treatment type that was here. And so they were several years following the end of their cancer treatment. And what we found, one of the things that we worried about is given fatigue, which is really common after treatment, would fatigue interfere with women's ability to attend the sessions? And so you can see the numbers are a bit lower in terms of attending all the sessions, but still really, really good, which we think is fantastic. I should also mention that this was done online. So we were geared up, ready to run our first group on March 20th, 2020. Recognize the date. And pandemic control measures kicked in, and we had to quickly shift to delivering everything online, which turned out to be a real blessing in disguise because we could recruit women who were living in geographically remote areas of the region. And what was interesting is, at baseline, when we asked them, do you think mindfulness is going to help you? They had about a moderate degree of confidence, about a 6.6 out of 10. They said, well, it might, but they also had a lot of skepticism where they said, how on earth is breathing and noticing my body going to translate into my increased capacity for sexual pleasure? And that's a really common, very normative skepticism to have. And thankfully, it doesn't predict who does well in a mindfulness-based treatment and who doesn't. So having a healthy degree of skepticism at baseline is not a bad thing. So what do we find? And again, a couple of quick slides in the mindfulness group, a significant improvement in the breast cancer survivors' desire and a significant decrease in their distress that was retained. And these are clinically meaningful improvements. And what about pain? All of our participants had pain, and again, a dramatic decrease that was maintained at follow-up following their practice of mindfulness. So what can we conclude from all of this? Well, based on this collection of studies, we have evidence that whether it's delivered in person or online, that mindfulness can be really effective for improving domains of sexual health. in women and in cancer survivors, and that the effects are large. And when we compare the effects to, say, some of the pharmaceutical treatments that have been approved, the two that I described earlier, the effects are much larger. And really importantly, the benefits are retained in the long term. Now, in my last 2 minutes, I want to share with you some of the exciting stuff that we are doing now. Now, you might say to yourself, okay, well, that's all well and good, but I can't get to a clinic, or I live in a remote town, or I can't afford paying to see a healthcare provider. And the truth is that there's a lot of barriers that prevent people, and women in particular, from getting evidence-based care for their sexual difficulties. And so our team started in about 2017, developing a tool that we call eSense. And what we do is eSense, it looks just like an app, but it's web enabled. And the reason we wanted it web enabled is we wanted to make sure that if women didn't have a smartphone, they could go into their library or their community center and use a public computer and work through the materials. And so we started out by doing some feasibility studies and usability. And then we tested eSense on a much grander scale. So what is it exactly? It's 2 arms. So one of them delivers cognitive behavioral therapy and one of them delivers mindfulness-based therapy for low sexual desire in women. And it integrates videos and GIFs, and there's 3 women that you follow through the stories and you watch them interact with the material. And when we measured eSense in a large sample of women with low desire, you can see that quite a few of them had improvements in their desire, quite a few of them had less distress, and the majority had more relationship satisfaction as a result of it. And so what we've been doing over the last year is we've been adapting eSense to cancer survivors. Again, this is a group I absolutely love learning from and working with. And so the first stage was working with a group of survivors who worked through eSense and then taught us what needed to be adapted to make it suitable for cancer survivors. So we have new cases who are cancer survivors. We have a lot more information on how cancer impacts sexual health. And we finished that work about a year ago. We created the platform and now we're recruiting. Now we're starting just with gynecologic cancer survivors because that's where the funding is coming from. It's actually coming from Rivkin. But our goal is to, once we show that this works with gynecologic cancer survivors, is to open it up to all female cancer survivors. And so if this is of interest to you, if this is of interest to someone you know, a survivor of gynecologic cancer, who might want to work through this, it's totally free. You can scan the QR code here. You get access to eSense for free. In fact, we pay women a little bit because we have some questionnaires that we're delivering. So our long-term hope is to make this available to cancer centers. So it eases some of the burden on survivors and their partners, but also on staff and healthcare providers who are ill-equipped in knowing how best to manage these very, very common sexual difficulties. So that's kind of our long-term vision, is to make this available to centers across, well, we'll start with North America and then we'll go from there. So in conclusion, sexual health concerns after cancer are real. And it's really important that you feel validated, that you don't feel like this is just a byproduct of, feeling anxious or being depressed, that your sexual concerns are real, that they're legitimate, and that you deserve someone who listens to you and pays attention to you. I've also hopefully convinced you in this very brief amount of time that mindfulness practice can improve many facets of sexual desire among survivors. As an aside, we tested this in couples. So where the main patient was a prostate cancer survivor and that person's partner. And so we delivered the mindfulness to couples, and that was a lot of fun to do. And by the way, it worked. Not to restore erections, but to restore pleasure, to restore sexual communication. So it can also be a tool for fostering sexual communication in a relationship. And finally, I think many of our fields are moving towards digital health tools and interventions in an evidence-based way. So I'm really excited to see where this field goes in the future. Those are my, that's how you can reach me if we don't get through questions today. I'm pretty active on social media, so that's my handle on Instagram. And then my research team, my lab, we use UBC Sexual Health Research to post information from our studies, or we synthesize new scientific studies and disseminate it to the public. Anyone who's interested in actually downloading any of the meditations that I have guided, they're all for free on lauriebrotto.com. Just have to pull down one of the drop-down menus, and you can just save it to your own device and listen to it. You can see right away the length of them. So there's some that are relatively short, and then there's others that are a lot longer. And then as Laura mentioned at the beginning, here are my books. So Better Sex Through Mindfulness is kind of a summary of the science of what mindfulness is and how it works when it comes to sex. And then this is the workbook that I wrote to really guide women to work through the practices on their own. So with that, I am going to stop my share, and I would love to hear if there are any questions from anyone here today.
Brotto, thank you so much. This was an incredible presentation full of not only the ability to practice some of this, but like all of the science and the hope for using mindfulness and the effectiveness of mindfulness in this such important and not always addressed space. So thank you so much. This was incredible. We do have a few questions. One, if you turn in with yourself, if you tune in with yourself, excuse me, if you tune in with yourself, does it help you prolong orgasm or have an orgasm not so quickly?
Oh, that is excellent. So I've got two answers. One is based in science and one is based in anecdote and kind of what people tell me. I'll give you the answer that's based in science. And we actually tested this in men with premature ejaculation, which essentially is orgasming too quickly. And kind of the leading theory in orgasming too quickly, well, one of the main theories was that kind of worry about orgasm and catastrophizing and thinking about the outcome can actually create a stress response that leads orgasm to happen very, very, very quickly. And so very much what we did in that study is teach the men to be present. As soon as they notice their minds taking off into the future, worrying, catastrophizing, being hypervigilant, they came right back. And what we showed in our scientific study was that indeed it was very effective for them in prolonging the onset of orgasm. Now, I'm going to assume your question is, well, what about women? So in all of our studies, we do also measure other facets of sexual response, not just desire and pain, but we measure pleasure and orgasm and arousal and lubrication and other things like that. And typically the finding that we have, although our qualitative data also tell us that it helps women really prolong their orgasm to help, so sort of helps them sustain it if they can be really present with it. But what we measured in our studies was that it actually increased their ability to reach orgasm. And so the mechanisms are somewhat the same in men and women. So many women will say, and this is also not uncommon after cancer treatment, will I be able to reach orgasm? I had a surgery that, cut through the really important nerves. And my doctor told me I did not have nerve sparing surgery. And so if you sort of believe that, you're going to expect to not reach orgasm. And so mindfulness can allow one to just see those beliefs as just mental events, as background noise, and let's really focus on arousal and pleasure. And that was, I think, for me, when I was learning mindfulness and working with the gynae cancer survivors in Seattle, that was one of the most profound things that they taught me. And I'll never forget the young woman who said to me, I thought my arousal response was dead. I'm only 32 years old, and I thought I would never have arousal again. And I can't believe that this tool, paying attention, not only allowed me to reconnect with arousal, but I actually feel it in such a strong and profound way. So I guess my advice for you is try it. Try it and report back.
Thanks, Dr. Brotto. I believe you and I already discussed that we're going to send out the presentation in a PDF format later on after this presentation is done. Somebody asked if the QR code will be sent via email, so it'll be in the slides just to answer that question quickly. Another question, would there be any benefit for other cancers such as breast, prostate, etc., for eSense? I see a lot of breast cancer survivors with sexual dysfunction.
Yeah, I absolutely. And again, I mentioned that the reason why in eSense we're testing this among gynecologic cancer survivors is because the funding came from a gynecologic cancer foundation. Um, but we've done so the breast study that I shared with you, the online study was for breast cancer survivors with sexual difficulties, and we've also done mindfulness for prostate cancer survivors and couples. And so that's our longer term hope is following eSense gynecologic cancer. My hope is actually to open it up and have quite a mixed group of different cancer survivors, maybe even pre-cancer, working through it and providing feedback on what it was like for them. So really the goal in all of this is to equip survivors with evidence-based tools. Um, Women, anyone shouldn't have to suffer in silence. And yet we are still shrouded in so much shame and secrecy. And it's heartbreaking to hear that. And then, and the fact that it's layered on top of that, having to just kind of navigate cancer and figure out what is my new normal. I know not everyone likes that term, but who am I now? And to navigate sexual health. I will say, and I think it's worth mentioning, that I've heard on so many occasions in the past from survivors I've worked with that having a sexual difficulty secondary to cancer was actually a catalyst for improvement for them because prior to that, they never talked about sex. They kind of took their sexual response for granted. It just happened spontaneously. And now they've learned the importance of prioritizing and planning and paying attention and communicating and using a good lubricant and all of those things. So I think that's a really reassuring message at the same time.
Yeah. I love that you shared that. As in my practice, I've heard the same thing. So anecdotally, also kind of hearing that same feedback of it's the launching pad for communicating about this a little bit more within relationships. Um, Breast cancer survivors that had pelvic surgeries like having ovaries or fallopian tubes removed, are they eligible for the eSense program?
Contact me. You should be. That's a great question.
Okay,
That hasn't come up yet. Um, but yeah, contact me. You have my email, my QR, and we'll see if we can make it work.
great.
Yeah.
Thank you. Um, Someone else asked, and I'm going to shift this just a little bit in regards to mindfulness. Can you reiterate again how mindfulness helps reduce that sexual pain?
Yeah.
That for some lube
Yeah.
doesn't isn't
Yeah.
enough, doesn't work, and sex
Yeah.
is still painful.
Yeah. Yeah. And this is something I know I only showed you kind of, the take home message, which is it works. And I didn't get into mechanisms and understanding. But there's actually been a lot of research on this that shows, especially with chronic pain. So, pain in the context of cancer treatment and survivorship, there's lots of different contributors, right? So we talked about, and you're going to have a whole lecture on this. We talked about, the impact of radiation therapy, leading to sclerosis of the vagina, so a shortened vagina, which can make penetration difficult. There can be fear of sex that leads to pelvic floor tightening and therefore pain. There can be changes secondary to having the ovaries removed or iatrogenic menopause leading to thinning of the vaginal wall, vaginal dryness, thin frailty, and thus pain. But then there can also be kind of chronic pains. And we know that a fair number of survivors can develop general chronic pains. And the kind of source of the chronic pain is in the brain, and it has to do with what we call central sensitization. What that means is that the centers of the brain that sense pain have been upregulated. They've become much more sensitive and they misperceive touch as pain. That's kind of a leading theory of many of the chronic pains and can be very, very frustrating for women who, might go to their doctor and they say, "Oh, it's so painful. Please do an exam on me at my vulva, my vagina." And the doctor says everything looks totally normal. And so very often it's because we're missing the source of what's perpetuating the chronic pain. And it has to do with that part of the brain that is sensing pain when there's only a touch. This is where mindfulness works. Mindfulness is a brain therapy. And what it does is when we pay attention repeatedly and with practice, and if we had more time, I would have guided you through a practice where I invite you to elicit a pain. And you could do that pretty easily just by holding your hand in the air for 3 minutes, and you can start to feel pretty pounding pain. And then I would guide you to pay attention to the sensations, notice the vibration, notice the heat, breathe through it, as opposed to, oh, this pain is awful. When is this going to go away? I'm so weak. Why can't I work out, etc. And so what mindfulness does is by focusing on pure, bare sensation, it leads to the other parts of the brain, like the pain center, like the emotion center, like the thinking center. It leads them to quiet down. So you just have activation in the part of the brain that senses pain alone. And it turns out that this phenomenon called decoupling is directly responsible for how you see reduced intensity of pain secondary to practicing mindfulness. Lots of imaging studies, lots of PET scan studies that have done this. It's absolutely fascinating. So the brain does change as a result of practice.
Thank you so much. That is fascinating.
Sorry, I got a
It's
bit nerdy in there,
no,
but
no, it's great. I love it.
I think it's helpful to know the mechanisms because, again, at face value, you might say, I don't get it. Like, how can breathing help this? It makes no sense to me. So,
Yeah. Well, and even that explanation, like understanding the decoupling in the different centers of the brain is certainly helpful to understand how breathing actually helps reduce pain. That's very helpful. Um, Someone else shared, my issue is imagining what my partner sees when she sees my scars.
yeah,
Is that me being a
yeah,
little too mindful?
yeah, yeah. And I just want to validate that. And it's a real fear that survivors will share, particularly if a partner has also taken on a bit of the caretaking mode through cancer treatment. And so how do we shift back to lovers? And so it is a real concern what you're expressing here. And I love that you put in there a little too mindful. And yes, if we hyper focus and start to think, because what we're doing in mindfulness is we're not actually thinking, we're sensing, right? We're sensing. So ideally, this is done with your eyes closed, where you're not seeing things that force you into thinking. You're not thinking about how you're breathing. You're not thinking about the sensations. You're experiencing the sensation. And so this is where I would titrate down the number of signals that are coming up to your brain by turning the eyes off and really focusing on sensation and touch. Now, this may also be a totally separate conversation to have with a partner in order to check out whether your fear is founded and rational or totally unfounded. And in my experience, because I do a lot of work with couples, um, way more often than not, it's the survivor's fear, but it's not one that's shared by the partner. Now, what if it is? What if the partner says, yeah, I'm having a really hard time, touching you? Well, here's where, doing something like sensate focus, which is a couples-based mindfulness touching exercise, can help both people. And I love sensate. We actually integrated sensate focus into our mindfulness group as well. So, yeah, thank you for asking that question.
Yeah. Is there a good resource to find sex therapists who have this sort of expertise in supporting cancer survivors who also need support in reestablishing their sexual relationship post radical hysterectomy?
Yeah. So there's a couple of resources that are out there. I maintain a list, and I add to it every year of providers around the world who are specialists in both sex therapy and mindfulness. Now, that doesn't mean necessarily that they're a psychosocial oncology provider, but they kind of bring this training together of sex and mindfulness. Another excellent resource is STAR. SSTAR. So starnet.org, which is the Society for Sex Therapy and Research, has a find a clinician, and you can search by state. And then it gives a list of everyone who is, a well-qualified sex therapist. That's another route. And then there's a group called the Sexuality Networker. And actually, when Sharon Bober comes to speak in a few weeks, she was the former president of the Sexuality Network. And it's basically a collection of cancer care providers who are dually trained in sexual medicine and sex therapy. And so she maintains that list as well.
Thank you. Do you mind sharing the mindfulness one more time? I'm just putting these in the chat for.
Yeah, so what I can do is I can type it. So to get a list of anyone who is dually trained in mindfulness and sex therapy, email me. And
Okay.
so lori.brotto@ubc.ca. Starnet.org is for sex therapists that you can search by state. And then the Sexuality Networker is psychosocial oncologists who specialize in sex, and Sharon Bober maintains that list.
Thank you. I actually had a question for you as well. So I believe it was the first study that you were discussing between the CBT and the mindfulness um, piece, and the incredible outcomes that you received. And it sounds like you've done this several times in different ways, but um, how could someone potentially access a group like that? Or if for those of us that are providers on the call, how do we get trained in being able to offer that type of intervention to support the mindfulness-based interventions for, or specifically group interventions is where you studied it for our patients who are experiencing low sexual desire or pain?
Yeah, great question, Lauren. And, unfortunately, there aren't. Now, there are several large credentialed mindfulness training centers across the US and Canada. And so I often say to providers who are interested, take an MBSR, which is mindfulness-based stress reduction, or mindfulness-based cognitive therapy certification course. They don't touch sex. That's the unfortunate side. And so you would have to sort of adapt that to your own. And similarly, there's lots and lots of mindfulness groups, community centers. I know in my neighborhood, community centers offer drop-in mindfulness groups online. Many apps like Happify and Calm and Headspace and Buddhify. There's lots and lots of apps that deliver mindfulness. Again, none of them address sex. So how do we get at the critical need for training in this area, and how do we get these resources out to people to benefit? So apart from that first list that I mentioned, and some people really want to work with a provider one-on-one, other people don't, either by personal choice or due to other barriers, financial barriers, geographic barriers, emotional barriers. And it is the reason why Kyle Stevenson and I developed eSense. It's also the reason why I wrote my second book, the workbook, and put all my meditations for free online, because I want people to be able to access them. So I'd say, start with whatever you can. You can even jump onto YouTube and Google 10-minute mindfulness and be guided, start there with 10 minutes a day, just to kind of get the brain into that mode of paying attention non-judgmentally and on purpose, and then sort of see where that takes you. For some people, they find that kind of the adaptation to their sexual well-being and their sexual relationship, that they would much rather do that with a healthcare provider.
I don't think we have any other questions, but we have a lot of thank yous riddled in the chat already. This was an incredible presentation, just full of so much helpful and applicable information for hopefully everybody who came, both those who have experienced a cancer diagnosis, those who are loved ones, and those of us who are providers. So thank you so much. What a rich presentation. We're so thrilled and honored to have had you here tonight. It truly has been such an enriching piece of our program. So we are very grateful and excited to be able to share this recording with all those that were here tonight, as well as those that were unable to attend, because I know they will all benefit.
Oh, thank you. And for those of you who are about to go off and have dinner now, I invite you, take the first few bites or the first couple of minutes and make it a mindful meal, and just take note. of what that feels like.
Thank you so much, Dr. Brotto. For those who are joined us tonight, thank you so much for being here. We couldn't hold these series without all of you attending, so we're very grateful for your continued participation. Our next session is in 2 weeks, and so we're excited to see you back here again on March 4th. And again, Dr. Brotto, thank you. Have a wonderful evening, everyone.